Welcome to Connected by Health. I'm Dr. Krishna Vedala. This is where medicine meets leadership, innovation, and humanity with one goal: to add value and help change healthcare for the better. If you believe health is about more than a diagnosis, you're in the right place. Dental health is an important public health issue because oral disease affects millions of people and can significantly impact overall community health and the quality of life. Poor oral health, including untreated cavities and gum disease, has been linked to chronic illnesses such as heart disease, diabetes, and respiratory conditions, increasing the burden on healthcare systems. Limited access to dental care can worsen health disparities, particularly in low income and rural communities, leading to preventable pain, infections, missed school days, and lost economic productivity. Expanding preventative dental care, oral health education, and access to affordable treatment can improve population health outcomes while reducing long term healthcare costs. And joining us today is Dr. Tina Saw, herself a dentist, and the founder and CEO of Oral Genome, a revolutionary health technology company providing point of care saliva testing platform that uses artificial intelligence and machine learning to analyze oral health biomarkers in just a few minutes. Thank you, Dr. Saw, so much for being here today.
Thank you for having me. I appreciate it.
All right. Can you tell us a little bit about yourself and what made you want to go into dental medicine?
Well, my name is Dr. Tina Saw. I'm based actually out in San Diego. For me, I always had an interest in just like the healthcare and whole body health. And I was also like a really like artist when I was younger. And I thought, oh, this is a really great blend of things because I feel like when you do restorations on your teeth, it kind of looks like art and you make people really happy and stuff like that. But, I really got intrigued by the mouth and the body connection and the oral systemic health, especially like in college when I was doing some research. And then it really helped, like, I would say that really solidified when I was a dentist because I would see different things that happened in the body, like diabetes, and they had a lot of like, you would actually see reactions in the mouth to it, and they were starting to have early signals. And so that's kind of just a little about me and, why I pursued Oral Genome.
Awesome. Well, thank you for sharing us your story. And once again, we're thrilled to have you here. And can you tell us a little bit about Oral Genome and what factors led to its creation?
Oral Genome is a 15-minute start to finish point of care chairside test. What that means is that you don't have to mail it to a laboratory. You get the results right away chairside. The reason why I had started the company was because as a dentist, I had seen a lot of us going in to just look at the x-rays, look at things with our probe and also our explorer and detect cavities and perio disease when it had already happened. For me, what I recognized in medicine is that we were doing a lot of lab testing, and that lab testing was coming back and showing us early signs or what was going on in our body. And I think as dentists, we should own saliva as signals, but there wasn't really a quick and easy way to like read all of that. So hence I was like on this journey of how do we develop a point of care test so that we can go ahead and help patients with a treatment plan really right away.
Wow, that sounds really exciting, and I think it's a very important tool to have. And one of the reasons why is one of the unfortunate circumstances in our society today is that oral health is often separated from the rest of healthcare. This is why people have medical insurance and dental insurance, which I kind of find a little bit preposterous because at the end of the day, everything is connected. And that's really the whole point of and purpose of this podcast, and especially how you and I just talked about the medical or physical health ramification that you can have when oral health is left untreated.
Mhm.
From a public health perspective, how does dental care impact overall health outcomes? And why do you think it's been historically overlooked?
From a public health perspective, I know that public health does suffer, and just from talking with hospitals, is a lot of patients end up in the emergency room because they don't actually have dental coverage or they don't have dental care, and they end up having abscesses that are life-threatening. If we focus on the public health aspect of it, is getting people to more prevention care and also with more reimbursements on, I would say, even the Medicaid side, to be able to do more cleanings or fillings or anything or crowns just to like prevent these diseases from progressing and becoming abscesses, we're actually able to reduce our overall cost of medical care. There's just so much connection right now in research about oral and systemic health, but I think there's also a lot of health inequities that prevent us from having people go see the dentist to be able, like I said, one of the big thing is reimbursement rates. It's a big discussion in our community. Without great reimbursement rates, a lot of these people can't get care. Another thing too is sometimes transportation is an issue for these people. And one of the things that I really, really try to do with Medicaid populations and also with Medicaid insurers is how can we even send them a test like Oral Genome to do some sort of remote monitoring and care and send them even treatments that can be done at home. So
Mhm,
long-term wise, I think that for underserved populations, if we're able to tackle prevention earlier in the mouth where it all starts, we're going to be able to reduce the cost of care on the medical side long term.
mhm. You know, I just wanted to kind of briefly mention this for our listeners. The geographic Southeast really has been an area with very poor access to dental health, specifically in the rural areas. And it just is not a surprise that those are also the areas that have high rates of hypertension, diabetes, dyslipidemia, but also heart disease. And like you said, reimbursement has been an issue, and we get that. But I think it's about time that we really look at how can we incorporate oral health more into medical health and try to find ways in which we could mitigate the financial aspect of it. And you guys at Oral Genome are doing your part, tremendous work, especially with the rapid saliva testing. Let's look at another aspect of public health that I feel, unfortunately, due to, of course, misinformation, has really been under attack, and that is water fluoridation. And water fluoridation has been proven repeatedly again and again and again to prevent dental caries, to prevent dental infections. But unfortunately, it's come under attack recently. I believe even the state of Utah actually has banned water fluoridation. And it actually has been one of the most effective public health interventions in history. Can you explain to us how fluoridation works and what the evidence is behind its impact on preventing dental disease?
Yeah, I know it is such a hot topic right now. And I know that there are so many groups in oral health that are just lobbying to put fluoride back in the water. And it's because we know as dentists, it's not really harmful at the very low doses that is administered inside the water that we intake every day. Fluoride actually acts as a barrier to your teeth and strengthens them and strengthens the enamel. And it actually makes that sticky bacteria go away and not stick to the teeth and cause cavities. The reason why that we as clinicians will go put fluoride varnish is it's sticky, it goes into the grooves of your teeth. It helps prevent the bad acid to start breaking down in your teeth. So, I think our whole dental community and even the medical community to a great extent is not really happy about that. I think there's a lot of misinformation about fluoride, but at super low doses, what they're putting in the water, it is, in my opinion, perfectly healthy to have that. So it will be really interesting to see as fluoride is removed from our water, what our cavity risk and like our caries rate will be in the next 5 years. My thought is that it will only increase.
hmm No, certainly. And you bring up a good point, which is unfortunately people have to realize and only realize the importance of a tool like fluoridation once it's removed, because then they'll be open to exposure from all these dental cavities and caries and infections. And it's kind of similar to vaccination. A lot of people don't really understand how effective vaccinations are because we don't see polio, we don't see smallpox, we don't see a lot
Mhm.
of these infectious diseases that used to have chronic debilitating disabilities, lifetime disabilities. And I just hope that fluoridation is not also something that's going to be repeatedly under attack unnecessarily because of misinformation. But the one thing I never really understood is what for those that oppose fluoridation, what is the main concern? Because we've heard a lot of different stories, intellectual issues and this and that. But what is their concern with having fluoride in water?
Actually heard the same thing. I think it's just misinformation. It's like things like it causes intellectual issues, just like you said, potentially like autism, or it causes like, just weird body effects. But,
Um,
I just don't think that, like, I don't know. I don't think fluoride can be attributed 100% to that.
yeah. Agreed. Totally agree. And I'm not going to open a Pandora's box and open a discussion about the causes of autism here, but just because we don't know what's causing it doesn't mean we can attack every other public health institution or public health tool out there. That's a whole different episode for a different day. We'll move on to continued concerns with the lack of access to oral health care. And of course, oral health care access does remain a major issue, specifically for underserved populations. What do you think are some of the biggest barriers today? And how do you think public health policies can evolve to close those gaps and barriers?
I think the biggest barriers today, from what I see and from tracking patients over time, is one, transportation, two, financial and cost, and three, also lack of providers. It is very, very clear. I think I see with like reimbursement rates that are been cut, especially on the Medicaid side. We have run different pilots in different states, and sometimes we've had providers drop because they dropped the Medicaid network because it didn't make sense for them financially. The other thing too is transportation. I think a lot, like, you and I are very blessed to have a car and, can go from place to place, but that's actually a real issue for people. And then also third, it's just like access, and even food access is difficult. I mean, I think a McDonald's hamburger is way cheaper than getting something really nice and healthy.
Sure.
And it has to do a lot with like your diet, and, sugary drinks are very inexpensive and easy to access. But I think that there's multiple barriers that are coming into why these communities can't really get the care that they need. And it's also education too. We also, as, insurance payers, as clinicians, and even our government, we need to go in and talk more about what healthy foods mean, and also how do we get it more cost effective. I mean, there are other things like, can we incentivize people to also go for the healthier foods? There's a lot of things that play out. And,
Mhm,
personally, I've also have been in a position where I was, struggling. And yeah, it's easier when you struggle financially to just go get the very inexpensive McDonald's. And
mhm,
so I think, as a society, we need to work a little bit more on how do we be able to like provide for the needs in a healthy way, and access to care and healthy food for these communities.
mhm. No, I mean, definitely. And access to fresh produce is a significant issue for a lot of communities in the United States. Food deserts are something that a lot of our listeners are probably not familiar with, but food deserts are geographic areas where you don't have access to fresh produce, or essentially the lack of sufficient grocery stores. And of course, with economic times being difficult, that always leads to certain sectors of the market space being shut down. And we have seen, at least here in Oklahoma, and I'm pretty sure across the country, certain grocery stores always being shut down because of economic hardships. And that people think it's just a loss of jobs, but it's also more than that. It's a lack of access to healthy food, like you talked about. And that's pretty important. And we always tend to look at things as a society in terms of money and just jobs, but we don't really think about the healthcare ramifications about the personal healthcare ramifications about it. And speaking of personal health care. We talked about this earlier today, but once again, oral health has been linked to a lot of different conditions, cardiovascular disease, diabetes, and even in some cases, pregnancy outcomes. How do you think that link between oral health and chronic illnesses and even acute issues can really help reshape the way that we think about when it comes to integrating oral health care into broader healthcare systems?
Yeah, I mean, I think there's a lot of things that we can do to like really reshape how oral health is connected to medical health. One of the things that, you said in the very beginning is dental insurance is separate from medical insurance.
Right.
And even in dental school and medical school, we don't get a lot of cross training. And I really, I know this is such a big, grand, long-term plan, but I think right now there should be a push to bring the industries together, to work together. I think that we see as dentists a lot of things that start in the mouth, but we don't necessarily have the exact training to be like, oh, or it's out of our lane to be like, yeah, you have cardiovascular disease. But the way that we right now go as dentists is we will say, hey, we're seeing some things that are suspicious in your mouth that may be also cardiovascular disease. Like for us, we go, oh, you have oral genome that is indicating like a high mmpa and a p gingivalis, which is actually highly associated cardiovascular disease. But today, for most practices and most dentists, that's just telling your patient to be like, I think you should go to a physician to go check something out. And we leave it to the patient to go and get that done
Hmm.
and leave it in their hands. And frequently I've seen patients and they come back 6 months later and are like, "Hey, on my notes we discussed this and that. Did you go?" I forgot. So I think our industry needs to figure out a way how to close the care loop and making sure our referrals are seamless. And there's also care coordination on the other side so that the physicians and dentists are working together and the patient is called and followed up. Because I think we have too many emergency room visits. We go to the doctor too much when things are too late, and it costs our system so much. So, if dentists and physicians can work together in a technological system that closes that care gap, then we're actually be able to make patients a lot healthier.
Well, you brought up something that I've never even thought about, which is integrating dental training with medical training. And that is something that even has never crossed into my mind. And it's probably because I'm biased. I'm from the medical field, but it makes so much sense when you say that, because there's things that likewise, even from the medical perspective, there's things that I see that are dentally related. And I ask the same question within my scope of practice. Am I allowed to do this? Well, there's dental abscess that I see. Well, why don't at least I start them on the antibiotic and then, like you said, tell the patient, okay, go see your dentist. But we just leave it to the patient. And the problem is getting into a dentist may not always seem easy, just because of a lot of different variety of issues like transportation or not quick appointments, or even in some cases lack of dental insurance. And I think when you're saying we should combine training or at least integrate training in some way, makes so much more sense now. And I totally agree
Yeah.
with you. Now it's something I've never really even thought about until you just mentioned it right now, which I think is just amazing.
Yeah.
And one of the things is I'm from Oklahoma, which is geographically in the South, and Oklahoma has about 77 counties, and I believe 56 of them are actually what are deemed as dental health shortages, meaning they don't have any dentist or any kind of access to oral health care within those counties, which is kind of incredible to think about, that more than two-thirds of the counties of the state of Oklahoma really don't have any access to oral health care. Do you feel that maybe increasing, I guess, the number of dental schools or increasing the number of seats, do you think it's a matter of just simply increasing the number of dentists to address that care? Or do you think it's a matter of providing sufficient resources, but also incentives for dentists to be practicing in those underserved areas?
I think it's actually more about, I mean, I think there's plenty of dentists in the United
Okay.
States. I think there's like 225,000 or 250,000 since I last looked.
Mhm.
I'm from a different part of the states. I'm in California, where
Yeah.
there's a dentist in every single corner. We're definitely not in a desert of dentists.
Hmm.
I think though I think what one of the things that we could do though, and we should do, is actually incentivizing dentists to move to these dental deserts and work there. I mean, I
Mm,
know there are also programs too for loan forgiveness and things like that help incentivize. One of the things I did come across probably just in the last year, and we've been having great conversations with them, is actually Pacific Northwest University, which is in a rural part of the state in Washington, where I'm actually from. And they actually ask students, to what's their commitment to continue working in a rural community. And they train these students in the rural community. And that's one of those things that, I mean, that they're very forward thinking. And I do think that there should be more dental schools that are centered also in those dental deserts, and
mhm,
also those students being able during their training to provide care in the dental deserts, and then having them also stay in the dental deserts too would actually help a lot.
mhm. No, definitely. And as we're talking about this, especially in rural areas, artificial intelligence, telehealth, how do you think
Mhm.
those could impact dental health care? Because I just don't see where, without having some kind of sufficient human oversight, I just don't see there's any way oral health care can evolve beyond human oversight. With the exception of course, with the testing you guys are doing. But when you're looking at whether if it's just getting your teeth cleaned or a root canal or any other dental procedure, I just don't see it simply an aspect of telehealth and artificial intelligence replacing dentists.
Yeah, that's actually a really good point because, I can't have like a telehealth visit with you and be like, I'm going to clean your teeth over the screen. It just doesn't work like that. The way that I see telehealth is it's a really good way for having an emergency and there's something going on and you need to talk to somebody and you need to get an antibiotic
Mhm,
quickly to help reduce the infection and the pain.
mhm,
Ultimately, though, it is telehealth's job and should be their job to then also tell that patient they do need to go to the dentist to get that infection treated. But
mhm,
there is a place for telehealth, but it cannot be a substitute, I would say, for going to the dentist physically. There's a lot of mechanical work that needs to be done. And even as a dentist, I'm really good at brushing and flossing, and I use my water flosser, but I
mhm,
still get tartar and calculus, and those are things that you can't address over telehealth. I think telehealth is also good in an emergency room situation. If a physician needs to talk to a dentist and have a quick look, but telehealth at the end of the day, we can't get x-rays. But it's a good means to, I would start saying, like, triaging patients.
If you could implement one policy change at either the local, the state, or the national level to improve oral health outcomes, what would it be, and how would fluoridation fit into that broader strategy?
Uh, oh my gosh, that's such a big question of what I would just implement as a strategy. You know, I'm really biased, but I think it's just like in pediatrics, we require every child, and even before I had my child go to school, we had to have a well check.
Hmm.
And I really would love to see this well check in dental be something that's required, and because we're able to catch things really early if we do an annual check. I really
Mhm,
think that's going to reduce the cost of care, just having one well check. And we talked about access to care barriers, but there's so many groups out there that even Oral Genome works with that can actually be portable and bring these well checks to these communities if they don't have a car or access. And part of that well check should be, you know, um, just taking basic x-rays, which again are portable. We have things like a Nomad that can just take x-rays really quickly. It should be a saliva check A saliva check will tell you your risks, and it will come up with the plan of what they can do at home to prevent diseases from furthering. And then the cleaning. If we do this, like, I can guarantee you we will see way less diseases and way less cost, and we'll catch everything early and have the complete medical referrals. And I also think it should be mandatory for medical and dental systems to be able to talk to each other. It's no longer just tell your patient that I think you have a medical problem and leaving it onto them.
No, I totally agree. I totally agree with that last part you said. We do need more integration, and we need to do that also for the sake of just reducing healthcare costs. And I think it would be one less visit for both of us, right? Real quick, any words of wisdom for our listeners looking into going into dental medicine?
For those who are going into dental medicine, I challenge you guys to continue really thinking through of, what you can do and how dentistry can move and work with medicine right now. I think that we go in as dentists when we go in for our interviews, we always say, hey, we want to help people be healthier. I think a lot of times we go in, and right now our whole system is changing a lot in terms of reimbursement, but really keep pushing that prevention and push what is good for patients no matter what. And so my thing for anybody looking to dental medicine is stay on track and keep in your heart what you want to do and continue on that track, because you're going to be off to doing really good things.
Awesome. Well, thank you so much, Dr. Sai. I really, really appreciate you taking the time and answering our questions. We look forward to seeing you again in the future, and we wish you the best. And of course, also Oral Genome, which we know is going to really revolutionize the way dental practice is practiced.
Thank you.
If you found this conversation valuable, share it with someone who could use it. And if you're on Apple, we'd love to hear your favorite takeaway and a review. See you next week.